Hey guys, Garth back here again for you. Well, I've been thinking about my next video with you guys as far as what's going on here. I got through the biopsy, I got through the PET scan, and the PET scan is this thing that they put you in after the biopsy to see if the disease has progressed into your bones, if it's metastasized, which is pretty scary stuff. And the surgeon told me that looked at me. He says, "Well, this hasn't progressed outside the casing of the prostate," which sounds to me good, right? And he said, "Yeah, it's good." But the thing with these guys is, and you got to get used to this. If you say, "Am I going to be cured?" They don't commit. They don't commit, and that kind of sucks. But that's the way it is. So he said, "You got to have a PET scan." So I go in, and this is a quick down and dirty thing. No problem at all. And you'll just lay there. They take the pictures, and then I asked them the same thing I did of the Jamaican lady when she did the MRI on me. I said, "Do you see anything?" And oh, I can't tell you that, man. I'm sorry. You're gonna have to talk to your physician. Well, the Doctor Blinkenblocken called me up and he said, "Yeah, there's no metastases. It hasn't spread into your bones. It's good." And I says, "Okay, cool, great. Now what?" "Well, you have to make a decision whether you want to do radiation or you want me to cut it out of you." And as I mentioned in the last video, if they cut it out of you, in my opinion, at 69 years old, I don't need all the heartache. I don't need all the pain. I don't need all the headache. And the research I've done has told me that the way mine is set up, personally mine, I'm not talking about you. I don't know if yours is spread or not, okay? But because it's not metastasized, because it's still in a area where it's like a little patch and shit in my prostate, that radiation will work just as well. So what they did was they told me, it's funny, surgeons and radiologists, they all think their cure is the best and they're going to suggest that. But I says, "Oh, I'm going to go with radiation." "All right." So the radiologist comes in. I meet him, and he tells me about all the stuff they got to do. And one of the preparatory things they got to do for you if you're going to do radiation is they're going to give you hormone shots. And I go, "What the hell is that?" And they go, "Okay, well, we're going to give you hormone shots, and they're the same shots that you get, if you want to get rid of the testosterone in your body." Now, this shit's going to scare you because this is the stuff people do that want to transition into another sex. Guys get this. But it's not as intense as that. You're not going to grow breasts and all that stuff if you just get the shots, they told me. And what this does is and I'm just telling you what the doctors tell me, the testosterone in your body, even at my age of 69, which is high, it feeds this cancer. It makes it grow. That's what makes your PSA go up. So the hormone therapy they give you kills the testosterone or eliminates it to where your PSA goes way down to nothing, which means this shit isn't spreading, and that's good. Now, what happens? Well, you go in, and the first time you go in, which has already happened to me, that's why I'm telling you about it, is first time you get 2 shots on either side of your abdomen. They're not bad. I hardly felt it. And it takes 30 to 40 seconds to count it down, which is kind of creepy, but they count it down while they slowly push this into you. Now, after you get the first 2 shots, if you're just getting the shots, which most of them recommend, you don't have to worry about, your breast growing and all that horse shit. But if they give you that plus pills, that could possibly cause you to put on extra weight in your breast area and shit like that, which is alarming. I know that, but they don't have to give me the pills. But I will be honest with you, I don't give a shit about any of that. I'm a fat old man anyway, and if that happens, it's not radical. It's hardly noticeable from what they told me. So if they tell you you got to do it, bro, do it. You know. But they told me you don't need the pills, and that's what causes most of that negative kind of stuff, right? So see Mickey Rooney in the background there. I interviewed him years ago for PBS. Anyway, uh, they thought Mickey Rooney. They thought I was his love child. We look alike. Anyway, so they gave me 2 shots. I went home, and the area was very, very sore, and I mean sore. It puffed up a little bit. It felt like a sunburn. It was uncomfortable as hell. I had trouble sleeping, but I thought it was a small price to pay. You know what I mean? And so this lasted about a week. This pain, and then it finally went away. Now they had to give me 6. They're going to have to give me 6 shots altogether, and so now I've got to go back for 5 more. And so they tell me that the second shot you get, series, you just get 1, and then you don't get that puffy, sunburny kind of feeling, and it's not a problem. Now I've noticed I'm gaining a little weight, and you will put on weight, they tell me, a little bit, unless you watch what you eat and exercise. I'm still drinking Baileys and, eating ice cream and all that crap, and so I'm going to lay off that stuff. So that's the shot thing. I got to go in and get another one, and I'll update you on that when I get the shot. So after the shots start, she told me, I had a meeting with this gal who's a urologist. She said that you're going to have to go in and get a surgery done where they're going to place 3 coils in your prostate around the area of where the cancer is, that patch. And what they're going to do is they're going to guide the radiologist when they, nuke you, without it spreading out any other part of your body, and they're just going to radiate the cancer and kill it. And she said they're also going to put and this sounds awful, but I don't know what's going to happen, but they told me they're also going to put a gel bag in between my colon and the prostate area, so that protects the colon from getting radiated. So this is some high-tech, crazy stuff. It's great. But I'm scared to death of this right now, and I don't know how the hell that's going to go. You got to go in for actual surgery. Now, she tells me they don't really cut you open. They stick a needle in you, a big needle in through your groin area, and they, follow the MRI map that they've already done on you where the stuff is located, and they puncture the prostate with this needle, and they place these tiny coils in. And they're 24 karat gold. So I can imagine what this costs. And she said they're the size of maybe a little smaller than a grain of rice. So they're not real big. And she said they're pretty safe. They don't migrate. They'll stay where they put them, so you don't have to worry about them breaking loose. It's very rare. And it's about an hour surgery. They have to knock you out, and you're going to have to do the enema thing and all that. But I'm not there yet. Right now I'm dealing with the hormone therapy. Now, before I leave, I want to tell you the one thing about the hormone therapy that I've noticed that they said was going to happen is I'm getting hot flashes. Now, for you guys that are married and retired and you had a wife who's got hot flashes, I got a lot of sympathy for her now. I'll tell you that right now. Because you'll be sitting there in a cool room and you'll think it's 300 degrees in there and the sweat will start pouring off your face. And you go, what the hell is this? And what this is, it's like a menopause thing that women go through, but it's a male menopause, and you get these hot flashes, and you'll sweat for like 3-4 minutes, really hot. You'll want to run outside, rip off your shirt, man, and then it's gone, and now you're cool again. And this has been going on now. Like, I get it about 10 times a day. I get it a few times at night when I cover myself up. But guys, let me say this. My PSA has gone down to like 3 now, and it was at 15, and it's still going down. And they're not cutting me open. They're not taking stuff out of me. So I think it's a small price to pay. This is my choice. They told me it would work. It's what I'm going with. So, small price to pay for me. It's annoying as hell. The good news is once you get off this stuff, I got to get like 5 more shots, and then they're going to do the coil thing and then the radiation thing. But they say it goes away. And they say your PSA goes down to nothing, and that's great. And they kill the cancer, and that's great. And then your testosterone goes back up again, which is great. So you are going to lose your libido. You're going to lose, you're going to get the hot flashes and stuff like that's going to happen. But other than that, it's so far so good for me, man. So, and like I said, let me stress this again. These shots don't hurt, man. I didn't even feel the needle going in. I will tell you a quick story. When they came in to do the 2 shots for me the first time, this gal comes in, she's the head nurse. She knows what she's doing. There's this other girl with her, kind of an older lady, kind of frumpy looking, but she was nice and all that stuff. She goes, hi, this is the older lady. She says, hi, I'm going to be giving you your shots because I'm learning how to do this and I'm practicing. And Megan here's the professional is going to watch me do it. I go, no, I'm not comfortable with that. Oh, I'm sure it'll be fine. Yeah, maybe you're sure it'll be fine, but I'm not comfortable with that. I want Megan to do it. and I felt bad doing that, but I figured, what the hell, if I got to go through this crap, I at least want somebody who knows what the hell they're doing. I don't want the intern or whatever it is working on me, At least she told me. And she says, well, I might have to give it to you the next time I go, next time, whatever, okay? But this time, my first time, so she gave me the 2 shots, and they weren't bad. I hardly felt them. I didn't feel the stuff going in that bad. Dude, it's really tolerable for what you're doing to save yourself. That's the main thing I want to tell you. All right, guys, that's it for now. Next step is I got to go back in. I got to get another MRI. Next step is I got to get the coil surgery. So that's going to happen next week. And when I recover from that, they say you're an outpatient. So I don't know. I'll tell you how it goes and how I feel. And onward and upward. God bless you guys. Hang in there. If you like this, please subscribe so other people see it. Please like it so other people will see it. And remember what I always say, man. Don't be a hater. Be a supporter. Take care.